Are there things you can do to improve the likelihood that the stem cell therapies are going to be effective? The answer is absolutely yes, and hyperbaric is definitely one of those to consider. Why? Here's the story. Imagine you have, let's use a joint as an example, and you want to do some stem cell therapies for that joint. The issue is that if you're trying to do stem cell therapy for that joint, I imagine you're either having pain and or degeneration of that joint. So now you have tissue damage, you have inflammation and cellular dysfunction in an area. And then you're going to add a whole bunch of naive stem cells to that joint, hoping that they start to shift the environment and create a healing response. The problem is that cells are often responding to the environment that they're living in. In other words, there's already destruction and inflammation in that joint, leading to further inflammation, further destruction, and further dysfunction. And so if we go ahead and add stem cell therapy to that joint, yeah, sure, certainly many of them will try to intervene and create a healing response, but so many of them could be destroyed or start to respond to the fact that you've just put these naive stem cells into an area that's urgently inflamed and dysfunctional. So to think that the cells are going to repair the environment versus the environment of that joint may have influence over those cells, that's a conversation that I think needs to be broadened in the field of regenerative medicine. This is where hyperbaric fits in. Hyperbaric has a way of reducing inflammation. We know that. That's not controversial to say or to think. We also know that hyperbaric is very healing and regenerative. So while it reduces inflammation, it improves perfusion, it improves capillary density, it improves mitochondrial function, ATP generation. So basically, you're already reducing the inflammation, let's say, of that joint. You're improving the cellular ATP production of that joint. You're already starting to create a healing response. And hyperbaric also increases your body's own endogenous stem cells. So if you go through a process where you go through at least 20 to 40 hours of hyperbaric, you reduce the inflammation, you upregulate the healing, and you start mobilizing your own stem cells. And in the midst of that, you then do a stem cell therapy that's now adding an entire layer of more stem cells to that joint or area of the body. The likelihood that you've now created an environment that is much more conducive to healing and much more likely that that stem cell therapy is going to take and be even more effective is much, much higher. So a standard protocol that we would use would be somewhere between 20 to 40 hours of hyperbaric. Again, that's going to start the process of regeneration, inflammation reduction, and stem cell mobilization. We would follow that up with whatever stem cell therapy a person was considering to do. And then within 48 to 72 hours later, we would go through another round of hyperbaric because those stem cells are going to require a lot of oxygen to start differentiating and becoming healthy tissue. And so we would follow that up with another 20 to 40 hours after the stem cell therapy as a way to nourish those stem cells and continue the healing process over the next few months. This is close to a 4 to 5 month process where you're taking certain steps to shift the environment, do your stem cell therapy, and then nourish the tissues long term to create this massive healing response inside the body. Is it possible that you're finding this video or you're coming to this conversation and you've already just done your stem cell therapy? And should you consider doing hyperbaric post? The answer is absolutely yes. It will continue to nourish and stimulate the healing response and keep inflammation low. So there's still a lot of benefit on the post side. But again, stem cell therapies are planned well in advance. And so if you're looking down this road and it's well in advance and you have the time, consider doing this protocol before, preparing the body to heal. Start already upregulating all the healing responses and regenerative cell signaling that your body requires. Then do your therapy and then nourish them long term for that broader healing response. All right. Thanks again for your attention. We'll see you next time. If you're a practitioner or you're looking to get into hyperbarics and you're wanting to learn more and making sure that you're offering this therapy as effectively and as safely as possible, I want you to know that we offer a series of courses, some of which are online and some of which are in person. At thehbotcourse.com, we'll include a link below. We have several courses available from training and certification in hyperbaric medicine, safety director, as well as a few different business implementation options to get the business up and running. So if you think that training and education would be helpful for you, take a look at thehbotcourse.com. Again, the link will be in the description below.